Good evening, students. Today we'll discuss first the blood supply of spinal cord. Then in further classes we'll go with the blood supply of brain. Then blood-brain barrier. So cerebrovascular accidents are leading cause of morbidity and death in the developed and developing countries. Consequently, it is important to know the areas of the cerebral cortex and spinal cord supplied by a particular artery to understand the dysfunction that would result if the artery is blocked. The internal capsule that contains the major ascending and descending pathways to the cerebral cortex is commonly disrupted by arterial hemorrhage or thrombosis. So nervous tissue is very delicate. It cannot bear hypoxia, not more than 10 to 15 seconds, because within 3 to 4 minutes, if hypoxia persists, there will be starting of irreversible damage. So it is very crucial that any kind of intracranial bleeds are treated accurately in desired time, because time is crucial in case of neurological injury. Arteries supplying the deeper part of brain are end arteries. So this is also one crucial point, end arteries. So once this end arteries gets damaged, there is no way that blood can reach that particular brain parenchyma. So that entire area supplied by these end arteries will be completely damaged. So in this session, we'll deal with the arteries of spinal cord. Then in further sessions, we'll go ahead with the arteries of brain and blood-brain barrier. Arteries of spinal cord. The spinal cord receives its arterial supply from three small arteries, two posterior spinal arteries and one anterior spinal artery. These longitudinally running arteries are reinforced by small segmentally arranged arteries that arise from arteries outside the vertebral column and enter the vertebral canal through intervertebral foramina. These vessels anastomose on the surface of the cord and send branches into the substance of the white and grey matter. Considerable variations exist as to the size and segmental levels at which the reinforcing arteries occur. So if we see overall blood supply of spinal cord, spinal arteries, so three longitudinal channels, that is one anterior spinal artery and two posterior spinal arteries. So this three, in some books we also refer it as five longitudinal channels, because this each posterior spinal artery will divide into two collateral arteries and descends on either side of the dorsal root. So we consider as five longitudinal channels which will be reinforced by segmental and radicular arteries. You can see here. So this is the anterior spinal artery joined by contribution from both vertebral arteries. And you can see this is a posterior spinal artery. So in this diagram it is directly shown that it is arising from the vertebral artery. So sometimes this posterior spinal artery may also arise from posterior inferior cerebellar artery. And here you can see this is a segmental artery which is entering through the intervertebral foramen and then dividing into anterior radicular artery and posterior radicular artery, which are passing along the respective nerve roots. The pia mater covering the spinal cord is having arterial plexus, which is called as arteria vasocorona, and this sends branches to the substance of the cord. So in brief about the posterior spinal arteries, the posterior spinal arteries arise either directly from the vertebral arteries or indirectly from posterior inferior cerebellar arteries. Each artery descends on the posterior surface of the spinal cord close to the posterior nerve roots and gives off branches that enter the substance of the cord. The posterior spinal arteries supply the posterior one third of the spinal cord. You can see here, this is the vertebral artery. You can see posterior inferior cerebellar artery, from which there is origin of the posterior spinal artery. So here you can see this is the anterior spinal artery. Anterior spinal artery. The anterior spinal artery is formed by the union of two arteries, each of which arise from the vertebral artery. The anterior spinal artery then descends on anterior surface of the spinal cord within the anterior median fissure. So branches from the anterior spinal artery enter the substance of the cord and supplies the anterior two-thirds of the spinal cord. So anterior two-thirds is supplied by the anterior spinal artery and posterior one-third is supplied by the posterior spinal artery. Segmental arteries. At each intervertebral foramina, the longitudinally running posterior and anterior spinal arteries are reinforced by small segmental arteries on both sides. These arteries are branches of deep cervical, ascending cervical, intercostal and lumbar, as well as lateral sacral arteries. So having entered the vertebral canal, each segmental spinal artery gives rise to anterior and posterior radicular arteries that accompany the anterior and posterior nerve roots to the spinal cord. So additional feeder arteries enter the vertebral canal and anastomose with the anterior and posterior spinal arteries. The number and size of these arteries vary considerably from one individual to another. One large and important feeder artery, that anterior medullary artery of Adam Kiewis, arises from aorta in the lower thoracic segments, especially at the level of T11. It is unilateral and in the majority of the persons enters the spinal cord from the left side. The importance of this artery lies in fact that it may be the major source of blood to the lower two-thirds of the spinal cord. You can see here, this is the artery of Adam Kiewis. So if we count, so this is the sacrum, this is L5, L4, L3, L2, L1, T12 and this is the T11. So close to the T11, the origin of artery of Adam Kiewis. So veins, the veins of the spinal cord drain into 6 tortuous longitudinal channels. These communicate superiorly with the skull, with the veins of the brain and the venous sinuses. They drain mainly into the internal vertebral venous plexus. You can see here two median channels, anterior median channel and posterior median channel, and you can see anterolateral and then posterolateral channels. So in these two you can observe that they are actually posterior to the nerve root. Here also it is posterior to the nerve root.